Welcome to Family Vlogs, and today we are continuing with our topic of infertility. If you have not subscribed to this channel, hit this notification bell for more videos that we'll post. In today's topic, we are going to discuss about causes of infertility in women. Causes of infertility in women. Now, for us to understand this topic of causes of infertility in women, we must have an idea of anatomy and physiology of female reproductive systems in terms of its structures and function of different parts of the female reproductive system, and also a basic knowledge of the hormones that normally regulates the functions of reproductive systems in terms of ovulation and fertilization and menstruation. Welcome again, and let's look at the anatomy and physiology of reproductive health of female, and then the basic knowledge of where the hormones are being produced in the human body of a female. For us to understand the causes of infertility in women, we must be able to know the basic anatomy of female pelvic organs and also the brain that normally help us in regulation of the hormones. Now, basically, we have some part of brain here and something here like this. I'm drawing the hypothalamus and pituitary gland together with the female pelvic part, the female anatomy of reproductive system. The part of brain that is very vital in regulation of hormones that will help us in this topic. Now we have the hypothalamus. Hypothalamus is normally producing what we call gonadotrophin releasing hormone, which sensitizes the anterior pituitary gland to produce two important hormones that is regulating the woman ovulation, menses, and menstruation, and eventually pregnancy. Now, these are follicle stimulating hormone plus luteinizing hormones. Now, in this part, we have the uterus, we have the fallopian tube, we have the ovary, and then we have the cervix. Now, in each and every pregnancy process, there must be some things that we must know before we explain the relationship between hypothalamus and fertilization, ovulation, and menstruation. First of all, there must be, for a woman to become pregnant, there must be a man. A man must produce viable semen. Both quantity and quality must be put into consideration. Semen must be very viable. When semen is introduced, then the environment in this place, in the cervix, in the uterus and the cervix, must favor them so that they can swim towards the fallopian tube to meet mature egg to be fertilized. And again, the woman must produce egg that is mature to travel to fallopian tube for fertilization. And again, these tubes must be free and viable to enable the sperms to swim and reach the target of fertilization. Now, hypothalamus produces gonadotrophin releasing hormone, which normally sensitizes follicular stimulating hormone, which normally help in the development of follicles in the ovary. And then when follicles are developing, now any problem that interferes with this process might result into causes of infertility. That one we must put into consideration, and we must discuss them bit by bit. Now, let's look at the hypothalamus. When there is a problem with the hypothalamus, for example, when there is insufficiency in production of gonadotrophin releasing hormone in the hypothalamus, thereby there will be no releasing follicular stimulating hormone and luteinizing hormone, thereby there will be no maturation and development of follicles and no ovulation. Then infertility arises. Now, when there is overproduction of gonadotrophin releasing hormone by the hypothalamus or underproduction of gonadotrophin releasing hormone by the hypothalamus, it will interfere with this process, and this might result into infertility. Pituitary gland also produces prolactin, the hormone that is normally helping in breast milk secretion. When there is hyperprolactinemia, that is high level of prolactin in blood, it can cause a negative feedback in production of follicular stimulating hormone and luteinizing hormone, and this one will result of no production and no maturation of the follicle, thereby bringing infertility. For example, pituitary tumors normally interferes with the production of FSH and luteinizing hormone. Another issue that might also interfere with this gonadotrophin releasing hormone versus pituitary and follicular stimulating hormone plus luteinizing hormone is hypothyroidism, which normally causes negative feedback, and this one may result in no production of these two hormones and may result into infertility. Now, in the ovaries, we also have what we call polycystic ovarian syndrome, which is a triad of hirsutism, anovulation, and polycystic ovaries. And this one might also cause infertility. In fact, polycystic ovarian syndrome is the most common cause of infertility. In relation to ovaries, we have also premature ovarian failure. Premature ovarian failure. Other causes of infertility: one, if there is a blockage on the fallopian tube, maybe due to sexually transmitted infection, can result into infertility. Also in the uterus, if there is a problem interfering with the uterine wall, the uterine lining, for example, endometriosis, which is also a major cause of infertility. If you watch my videos on dysmenorrhea, I explain very well what is endometriosis and how it can be prevented. And again, if we have the thick cervical mucus that cannot provide a very conducive environment for movement of sperms, can also cause infertility. Or a big uterine fibroid that is growing at the uterus, extending even the edge of the cervix, can also cause infertility. In the cervix can be narrow, that is called cervical stenosis, thereby not providing conducive atmosphere for environment for the movement of sperms. That one also can cause infertility, and also ovarian cancers. Ovarian cancers spreading to this place, the uterus, or cancer affecting the cervix can also cause infertility. There are also some individuals that are born with congenital disorders of the cervix and the uterus. This one can prevent implantation of the blastocysts in the uterine wall for development of the fetus, or even can interfere with the movement of sperm towards the fallopian tube. Multiple sexual partners, those who normally contact gonorrhea, chlamydia, can also result in also blockage of fallopian tube, or even scarring tissues left at the fallopian tube, and this one will also interfere with the movement of either mature ovum or movement of sperms to for fertilization, movement of sperm to the fallopian tube for fertilization. When a woman develops ectopic pregnancy, we live during surgery. There might be some scar tissues that are present either in the fallopian tube or depending on how surgery was done. And you know, there are some cilia that normally propel the egg from the ovaries. When egg are mature, then the fibroid engulf it, and then it propels, the cilia propels it slowly. It's like somebody pushing from one point to the other. When that process, the cilia are interfered with, for example, there's a scar tissue somewhere here, then the movement of the eggs towards the fallopian tube to be fertilized will be very, very difficult, and this one might lead to the egg being disintegrated and no implantation in the endometrium, and this might cause infertility. Mycobacterium tuberculosis, that is TB of the pelvis, is also a major cause of infertility in women, and this one also can bring scar tissues in any of the place that it has affected in the pelvis. So we can consider risk factors as a major cause of infertility, like obesity and exposure to chemical and radiations, and also chronic diseases, those who have been bedridden for long, and psychological stress or psychological trauma. Psychological stress or psychological trauma is thought to be interfering with the hypothalamus pituitary axis, and you know this is very, very important for follicular stimulating hormone and luteinizing hormone to produce, thereby helping the process of becoming pregnant. That one we call hypothalamic amenorrhea. There will be no even menses, and one warning sign of infertility is lack of menses, that we call amenorrhea. Aging is a contributory factor to infertility. In fact, it's a cause of infertility. When we started with risk factors, we mentioned that if you are 30 years and above, you risk being infertile. And when you are going to menopause, that is 45 and above, there's what we call ovarian reserve. It's the ovaries and the mature follicles are depleted, and this one can cause infertility. That is few ovaries left. Even if this process is going on well, there is few follicles to be matured, thereby it results into infertility. Last cause of infertility is what we call idiopathic or unknown. All investigations have been done, laboratory test, pelvic ultrasound, MRI, CT scan, and everything is normal, but still, even hormonal profile has been carried out, progesterone level, estrogen level, follicular stimulating hormone have been done. Until now, you cannot get pregnant. That contribute to 10%, and it's called idiopathic. Now, remember, 30% of causes of infertility is based on men, another 30% is based on females, and mixed is both female and male is 30%. One thing that I would like to put across is that females should not be blamed of not being pregnant, because all those percentage are equal in both male and female. So causes of infertility, when we be discussing causes of infertility in men, if a couple cannot conceive, we should not blame any, because we have a ratio of 1:1 in causes of infertility. The couple should be visiting a fertility hospital for proper and thorough investigation, and a solution will surely be found. Thank you for watching, and if you have not subscribed to this channel, please hit the notification bell for more videos that I will post, and kindly join me again on part 3 of this video on management of infertility.